AndreaTooley.com. Thanks so much for watching this video. I'm here today with Dr. Rondell Graham, who is a pathology attending here at Mayo Clinic. I'm so excited for him to talk to you all about pathology because I don't know anything about path. So we're going to learn a ton together, and Dr. Graham's going to teach us all about it. So thank you so much for being here, Dr. Graham. This is just great.
Thanks for having me, Andrea. This is terrific.
So how we first met was actually last year when I was a first-year ophthalmology resident, and we do 2 months of pathology, and we do it in the pathology department, and Rondell was a fellow at the time, and he was the most friendly, most wonderful fellow, and you were like, welcome to pathology, it's so great here, like, let me help you with the microscope.
Right.
And so ever since then, we've kept in touch, and I wanted to pick his brain all about pathology so that you guys can learn about the career path and everything that kind of goes into that specialty.
Perfect.
So can you just tell us about yourself? Where are you from? How'd you get here? What are you doing? All that kind of stuff.
Perfect. Well, I went to medical school in Jamaica. So I grew up in Barbados, went to medical school in Jamaica. Typically in that system, we don't do an undergrad degree first.
Okay.
So I went from high school to medical school in Jamaica at the University of the West Indies. And in that medical school, almost all of the candidates are from the West Indies.
Okay.
And so I completed medical school there, an internship. The system is a little bit different because the medical school lasts another 5 years of training, and then there's an internship year and a senior house officer year.
Okay.
And while I was there, I really enjoyed pathology. I thought it was so fascinating. The thing that I thought was most interesting were the inherited polyposis syndromes. And I thought, well, pathology is great, but I was a little bit hesitant to go into pathology as a career because I didn't think there were that many pathologists in clinical medicine. So in my medical school, there may have been almost a dozen anatomic pathologists, but that was the greatest concentration of them anywhere in the Caribbean. So I think in the remainder of Jamaica at the time when I was in medical school, there may have been 1 or 2 more pathologists. And in Barbados, where I'm from, a country of almost 300,000 people, there may have been 3 pathologists.
Oh my gosh.
So I was really hesitant. Hardly any.
Wow.
So I was hesitant, but I thought about it a lot, and I received a lot of encouragement from people in the pathology department there to apply for a residency in the U.S. They were very supportive, and I was really happy that I spent time there because I think they really helped to develop my interest in pathology, my love for pathology. Mm-hmm. And so they encouraged me to apply, so I applied. I did the USMLEs, applied to residencies, and at first I didn't apply to Mayo. Because I didn't think it was possible to match with Mayo. And so I did it initially until they told me, well, there were people from the medical school, same medical school, ahead of me who had matched in internal medicine and pediatrics.
Wow.
And so I said, I'll give it a try. And then Mayo called me for the interview. And then I came here, so yeah.
And so you were here at Mayo Clinic for residency, and then you stayed on for fellowship.
That's correct.
And what did you do for fellowship?
So for fellowship, I did molecular genetic pathology, surgical pathology, and GI pathology. So lots of fellowship training, 1 year each. Not sure I would recommend doing 3 fellowships, but it was a lot of fun.
That's fantastic. And now you're on staff, a consultant here at Mayo Clinic, so he's the boss.
Hardly.
And so can you just kind of back up for a second and tell us what is pathology? Okay. Because I think a lot of people who are in high school or college, their exposure to pathology is more on all these like crime scene shows and the forensic pathology. And I get lots of people asking me, like, I want to be a forensic pathologist, and that's totally different. Yeah. So can you tell us what is pathology and what does that medical specialty mean?
Okay. I think that's a great question, and lots of people have that question. I think pathology, broadly speaking, is the study of disease. We're broken into 2 main branches. They're the anatomic pathologists and the clinical pathologists. Anatomic pathologists are focused on principally making diagnoses based on material on glass slides. So, medical microscopy will be another way of kind of looking at it. And so all of those are tissue biopsies that are done or resections are done are examined by pathologists grossly, and then microscopically. And that's most of the activity of anatomic pathologists. The clinical pathologists then evaluate other specimens taken from patients, so blood for DNA testing, for biochemical testing, etc. So that represents a major part of the field of clinical pathology. And so there are lots of different disciplines in there. In fact, there probably may be more subdivisions in clinical pathology than there are in anatomic pathology.
Wow.
But they're all brought together in most pathology residencies, and so those residencies are APCP residencies. Forensics is a part of anatomic pathology and is focused on all the things that are shown on TV, but it's not the major part of pathology work. So, for example, in our practice, we have a large autopsy, what I would consider to be a large autopsy practice, and it's pretty busy. But if you look at the absolute number of cases, although you can't compare, an autopsy case to a surgical case, but we probably do 2 or 3 orders of magnitude more
Wow.
surgical pathology cases than we do autopsy cases.
Okay. And I want to ask you a question. You said APCP, so that's the anatomic pathology or the clinical pathology.
Yeah.
And you said most residencies are both of those.
Yeah, most residencies are both. Some residencies also have an AP-only track, and some have a CP-only track. And then there's another track for people who know they want to do neuroppathology, so study diseases of the brain, and they're AP-NP.
Wow, okay. So if you're in medical school and you were a foreign medical grad, so you didn't have, or an international medical grad, so you didn't have the same medical school structure as a U.S., but say you were a U.S. medical student, you decided you wanted to do pathology, what is the residency structure? How long is the residency? How does that work?
So APCP residency, that's the most common track. There are 4 years of APCP residency.
Okay.
AP only and CP only residency tracks are 3 years in length, and AP-NP is 4 years with 2 years AP and 2 years NP.
Wow.
Now, some people have a research year built into their residency training, and so that would extend their training by an additional year. So someone who's doing an AP residency or AP only residency with 1 year research will be doing 4 years of training.
Okay, but you don't have to do an intern year.
No intern year.
So it's just PATH.
That's right.
And what do you do as a resident? Because when I was there, I saw the residents and they have tons of slides and they're at their microscope and they're doing their readings. Is that kind of what's the day in the life of a pathology resident?
So I think the pathology resident's life is really exciting. Because of the diversity and the specialty, the AP and the CP components, depending on the rotations, they can be quite different.
Oh, sure.
So for autopsy, which a lot of people may be familiar with, you usually will start out by looking up the clinical information surrounding a case, why a patient has passed away, and then you will then determine the best approach for the case in terms of determining the cause of death, the manner of death, and whatever may be pertinent to that particular case.
Okay.
For people on the surgical pathology service or its subspecialties, usually there's a preview day where you will be examining slides from a variety of different cases, and they usually group by subspecialties. So there'll be the GI biopsies or the breast biopsies or the bladder biopsies. So you'll preview them for a period of time, and then you will sign up with an attendant, usually at a predetermined time. And at that sign up, you're gonna discuss the cases. What do you see under the microscope, and what do you think is likely to be? And you will discuss some special tests that you may want to do. And what's really exciting about pathology is a lot like problem solving. Every case is kind of a puzzle.
Yeah.
And I think if you enjoy solving puzzles, I think you'll enjoy pathology. So, there's some cases where we'll look at the routinely stain sections and we'll have a diagnosis and we'll be able to finalize the case. But then there are other cases where we need to do special stains that look at various markers to help us to solve that puzzle. And then there are other cases still where we have to do molecular tests. So we're going to have to examine DNA or RNA or both to try to come to a solution. So that's a typical day for pathologists. You'll do that sign out, then you will order these ancillary testing that needs to be done, and then you will maybe do some report editing or report production, some combination of those activities. And then that cycle kind of begins then on the second day, or begins again on a second day. There are some rotations, which will be like the general surgical pathology rotation, where the resident may be involved in grossing. So a specimen will come directly from the OR.
Right.
Sometimes it's going to be fixed, and the resident then will gross it. So they'll take measurements, maybe pictures, and then they'll begin to slice it to help to prepare the material for examination under the microscope.
Yeah. And that's kind of what we did when we had our ocular pathology rotation, which is nowhere near as hardcore as you guys, but we would get specimens in from the OR that day, so little conjunctiva biopsies or corneal transplant and the old cornea, or even if they had done an enucleation, we get the whole eyeball, and we'd have to take measurements of it, take pictures of it, slice it up, and put it in the processing media so that it could go be made into slides.
Right.
So
That's
even
right.
the residents get to do things like that.
Absolutely.
Okay, very cool. And I feel like you have to have this just tremendous medical knowledge. I feel like the pathologists, they just know everything. And I remember being in medical school thinking, like, wow, it would be so great to know that much. I think that would be so fun. Do you feel like your specialty kind of knows everything about everything?
Well, I think pathology is a great field, and what I really enjoy about it is that we have a large practice here, and when you combine a group of pathologists, it's really exciting the fund of knowledge that's available among or as part of a group, and so that's kind of one of the exciting things about pathology, and in a big practice you'll have a broad range of expertise, and so you'll really be able to provide answers to patients with lots of a varied set of problems and lots of different problems, and so that's really rewarding.
Yeah, that's so great. And what about fellowships?
Okay.
Are there a lot? I bet there's a lot.
Yeah, so there are lots of pathology fellowships. I talked about the pathologists there. I talked mostly about what anatomic or AP residents they will be like, or residents on the AP service. But for the CP service, those days are different. But they have fellowships as well, and their work is just as important, but based on a slightly different platform. So in AP, the workhorse is microscopy, and CP they're usually instruments of different types instruments that evaluate body fluids and other things. But in terms of the fellowships available in CP, there's molecular genetics pathology, which is one of the really rapidly area that's rapidly increasing in popularity. There is clinical chemistry. There is blood bank or transfusion medicine, medical microbiology, and others. And in anatomic pathology, then they cover basically every organ system. So there's GI, which has liver and pancreas combined with that.
Doing.
That's what I do. There's a pulmonary, there's neuropath, there's urologic pathology. So there's a range of fellowships, and I think that also makes it interesting. I feel like, pathology has a mix of things, and so there's something in it for everyone.
Yeah.